Good morning and welcome to Lincoln County Connections. I'm Casey Miller, Lincoln County's Public Information Officer, with my fellow Public Information Officer, Susan Trachsel. Good morning.
Good morning, Casey.
Pleasure to have you here. And this is a great opportunity for us to talk about what we do as PIOs, what the response is from not only us as Lincoln County government, but how we coordinate with organizations throughout the county. So I think one of the things we want to do, Susan, today is talk about, well, what is the county doing? But first, let's talk about quickly what that means for us to be PIOs. And you and I both have executive assistant type work. We do administrative work. We also do public relations work for the county. But as PIOs, that by definition describes what we do in the context of emergency management, FEMA, Federal Emergency Management Agency, Incident Command System. And that PIO definition of what we do means we have a role organizationally in emergency response. And do you want to talk about what that means to you?
Right, so what has happened specifically for this response is we activated, as we said, back in late February. We actually opened a department operations center before this was even declared an emergency. And it really is public information heavy at the start. We know what's coming, and so our job was get all the information we can get, set up a landing spot for locals to go and find that info, start pushing our messages out on social, and just get our own situational awareness in place.
Yeah.
Then the next piece was, okay, who else is out there that we can bring into our team? So that's up until yesterday, it was all me and maybe a couple other people working on this, full time. Overtime.
Yeah. Yes.
That's all I've done. And you mentioned executive assistant duties and public relations. I'm not doing that. We're focused 100% on this pandemic now, that as it's been declared. So now we're reaching out to Samaritan. We're in contact with Samaritan hospital systems. We're in contact with the schools. We're in contact with business. We're in contact with Department of Human Services, trying to figure out what's everyone doing, how can we gather that and share that information jointly so people aren't having to go to multiple different locations.
Yeah.
So that's really what we've been doing, is getting our website updated and updating it multiple times a day with accurate info.
Yeah, I think one of the things that as you and I over the years have evolved in our professional development as public information officers, the internet has evolved, social media has evolved, and now that everyone in a way is their own news organizations,
Right.
social influencers, we all have access to these powerful tools to share with our neighbors, share with our friends online, locally, and across the world. It poses certain challenges because as far as accurate information goes, we just want to help coordinate the most accurate information and share it with everyone. And so social media monitoring, for example, is one thing we do. I mean, we're looking at social media and saying, wait a second, no, that's not right, that's not right.
Right, that's a lot of what's happening right now, and that's another reason why we stood up our Joint Information Center, is because we need to have multiple people going out and monitoring what are the news reports. There's a press briefing at the state or federal level every day, sometimes with short notice, and we're just trying to get that info so we can relay it out. The other problem with the social media monitoring going on right now is in this county it's a lot of Facebook for a majority of our population, but our youth are not on Facebook. They're really not. So we've brought in a youth college student who's a credentialed volunteer who's going to try and help us work on getting that message out to youth, because that's really what's going to help, is our youth standing up and saying, no, I'm not going to parties. I do believe this is happening, and here's my role in stopping this.
Yeah. And so what if we learn from her somewhat? Where are the youth living these days, by the way?
Well, Snapchat, that's the biggest thing. Younger ones and some of us adults like TikTok. That's really it. There's some Twitter presence here, and we do have a Twitter account, but we're not seeing a lot of people here in Lincoln County on Twitter. So really, it's Snapchat. The problem we have as a government is we can't do Snapchat because we have to archive public records.
Yeah.
So now it's, how can we get those influencers out there to share our message on Snapchat?
Yeah, well, and over again, we keep directing people to the county's website. We've got a red banner going across our website. We've got our COVID link. We want to make that even more prominent. But really, we've got that landing page for COVID-19. And that is one of those central locations where you can find information.
Yes, and I'm the one who updates that and the social media, and we're going to get more people on board to do that. But we literally get talking points now several times a week from the Oregon Health Authority, and we are taking the most pertinent stuff that people need from that and putting it on that page. We are cross-linking to state agencies. We're also going to be expanding and sending out a regular notice via Everbridge to the community. So anyone who's signed up for Lincoln Alerts, like with an email, we're going to email out a document with everything that we know that's happening so you can have it in one spot. So that's really what we're trying to do, is get the info in one spot so our people don't have to keep searching and then mistakenly landing on things that seem true but really aren't.
Yeah. Okay, Susan Trachsel, Public Information Officer for Lincoln County, will be back after our first break in just a moment on County Connections. Back on Lincoln County Connections, talking to Public Information Officer Susan Trachsel is with us this morning. Thanks for joining us. One of the things that, as far as that downward flow of information goes, Susan, CDC, Oregon Public Health Authority, can you talk about how from the top down that's coming to us, and that's where a lot of our guidance is coming from? Absolutely,
yeah. The CDC puts out their guidance, and there is a huge team at the Oregon Health Authority that's been working on this for, I don't even know how long, before we started working on it. Yeah. And they're taking that and putting it into something that's useful for the state of Oregon to understand, and then using those rules to change how we do business here. So for example, when the CDC gives clinical guidance for our hospital people, the OHA is getting that information out to us, and we locally are pushing that out ourselves through our Everbridge system to the local providers, so they know, they know us, they trust us that we're going to send them the stuff we've vetted, and we know it's getting there. We're certain it's going to get to our people.
Yes, and creating clarity from the messaging we receive from them. I mean, it's mostly good, but things are changing so fast.
So quickly, within hours sometimes.
And I want to impress upon our listeners too, okay, I mean, we are in conference calls day after day, multiple times a day, to make sure that we're all coordinating. But let's talk about the players who are on those calls. We're on calls with Oregon Emergency Management. We're on the Oregon calls with the Oregon Public Health Authority. But let's talk about it locally.
Right,
school
locally.
District.
School district calls. We've got fire. We've got EMS. We've got hospitals. There's a daily check-in now every single day where our local command team basically is meeting. We met at 8 this morning. We have an operations teams for our health department at 8:30. We have a 10 o'clock check-in for our Joint Information Center, and that's on top of what Jenny Damaris and Sam Buckley are doing in emergency management, working with our fire, our ambulance, our hospitals, our whoever it is that they're reaching out to, and it's just expanding.
Yeah,
more calls.
It's really impressive to see, because we gather together and we run through all these organizations as a check-in to see who's on the call. They're asking us for information that we might have. We're really this epicenter of information exchange.
Yes, it's been quite busy, a little bit crazy, but fortunately in this county, we planned for this. We have done extensive planning, and we're just implementing the plans that we put in, and it's going well. We've been so busy without a single confirmed case, so that we've got the backbone done. So if and when, most likely when that happens, we're ready to go.
Yeah. It's impressive. It's impressive. I've wanted to almost film one of our cooperator calls just to build some confidence in the public about how well first responders and organizations work together.
Right, and we have cities on those calls. We have city calls too. It's not just the first responders. It's all government is involved in this right now.
So maybe we could jump into some of the hot questions and concerns that folks might be having. Rumor control is something that we work on, and I just wanted to throw out there, Susan, that also like the public access closures to Lincoln County government, those are available online on the county's website, at our official COVID website. So I'm not going to go through those one by one, but you can find that information there about how to continue to do business specifically with Lincoln County government. That is available for review. But Susan, what are some of the hot things that people are most concerned about? I imagine testing is one of these things.
Testing's a huge question right now. There's rumors out there that we're hiding info, that there's really a bunch of confirmed cases and we just don't want to say so. That's not true. As of this moment, at this time, I have not heard of any of them. And if there is one, I will get notified, because it's my job to set up the press briefing. So I have to know what's happening, and we are all in constant contact. But as far as the testing goes, there's multiple ways to do testing. Samaritan is the primary testing location right now because they have the hospitals. And they'll be sending out press releases as they make their changes on how they may do testing. Local clinics can test with doctors' approvals, and they determine how that test gets done and going to private labs. The problem has been the lack of testing kits, those swabs. If they're running low on them, they can't even do the tests until they get those supplies, and that's what's been the holdup, is the supplies.
So let's just walk through a process. If I thought I was exposed to COVID, knew someone who was, what would be the first thing that I would do? Contact my provider?
Well, first thing would be evaluate, how are you feeling?
Okay.
If it's mild, or you're sick enough to where in the past, say 6 months ago before we heard of this, you would just stay at home and chill and just treat yourself, drink water, do that. Don't even come in. Don't ever come in without calling anyway. But if you wouldn't have called your doctor before, or you don't have anyone at home that you're concerned about spreading the virus to, just stay at home and recover. If you have people in your life that you're concerned about that you may have spread the illness to, whatever it is that you have, then call your doctor. Call them and see what you can do. If you don't have a doctor, we've heard that Samaritan is allowing people to set up over the phone and set up and do that pre-screening on the phone to get set up in their system. So that's an option also. Okay,
so maybe in anticipation of having more testing, can we talk about the possibilities of DriveUp testing? Is that something that we know yet or not?
Those are always possibilities. We've seen it throughout the country happening. The local community health center through Lincoln County, our Health and Human Services Department, we aren't doing DriveUp testing. But as soon as we hear officially that something is in place, we're going to be sharing that info.
Okay.
But it's likely going to come from Samaritan first if there's going to be DriveUp testing.
Okay. We're talking to Susan Trachsel. She is a public information officer with Lincoln County. We're going to take our last break and be back in just a moment. We're back on Lincoln County Connections, and our engineers are saying we are live. I want to thank Uquinna Bay Communications for providing the vital service of terrestrial radio, and remember, this podcast can be reviewed again through Uquinna Bay Communications website. Really vital that we get this information out to you. Susan, one of the things that I noticed this morning was the Small Business Development Center, Oregon Coast Community College. And for those who are worried about business continuity, I see that they have links to resources such as layoff aversion programs and unemployment insurance, SBA disaster relief loan programs, and other general information. So an example of another partner who is trying to help the community. When we walk in here, for example, you can see that they only want one guest per radio show. So I really feel like people are pitching in and doing their part. We're all kind of getting up to speed. And in closing, or coming close to closing, any other key points that are on your mind this morning?
Mostly just for people to be there to support each other, virtually. So if you are staying home, there's technology that you can use to do group chats. I've seen my sister in Hawaii is doing that with people in multiple countries, because we still need to support each other, and there is that anxiety and wondering what's going on. So we've got to find new ways to connect with people. so we can get through this,
Yeah.
really. But I've seen lots of businesses here doing what they can to support. Last week we sent out support to businesses on sample signs they could post to say what they're doing, or make their own signs or their own communications through Facebook or whatever. There's a lot of that going on. So how can we support those businesses in the future? Buy those gift certificates, for future use. Or I think I saw something saying, we've helped all of your little organizations, now it's your time to help your local business get through this.
Yeah, I can say one of the things that our family is doing is using WhatsApp, for example. In the beginning we thought, okay, grandma can come and watch our son while we're at work, but we realized she was high risk. No way are you coming over. That's kind of, I noticed, a tough decision for her. Well, no, I'm fine, I'll be okay. And we're saying, we just don't want to take this risk.
Right.
So we're filming videos at home. All of the grandkids are, sharing those moments remotely. It's hard, it's tough to have this isolation. I know for us, we've got Reed using Khan Academy, and the school district has resources to keep the kids busy and working on their education even when they're at home.
Right, and that's going to be the key thing, is how can we keep some things as normal as possible. And it's hard because you can't see this. If you are ill, you know that you're ill. But we've heard, stories in the media about people getting the virus from someone who didn't even know they have it. And that's the hard part, is you don't know. So maintaining that social distancing to protect not only the people you love, but help keep that infection rate down as much as you can so that the hospitals are not overwhelmed. That's really what we're trying to do right now, is prevent something like what happened in China, what happened in Italy, what's happening in Seattle and New York right now.
Yeah, I think real good point there, which is we've got 0 cases confirmed, but we need to be proactive with this social distancing. That's how we're going to keep it at 0, hopefully.
Or low enough to where our hospitals can manage it. Because the people working in the healthcare system are already tired.
Yeah.
I mean, if I'm tired just being the PIO, working all these hours, I can imagine what the nurses are feeling and the doctors are feeling. And it's a marathon, it's not a sprint. It's going to keep going for a while, and we need to do what we can to make sure they do not burn out and we don't lose them. Yeah,
agreed. Yeah, as someone who has a nurse as a wife, I can see it. And it's just so vigorous, really, for all of us, and especially those of us who are trying to do our very best to get the information out to you. So in closing, I think we should remind everyone, our epicenter as Lincoln County government is on the county's website.
Yes, and if you have questions and you don't have a website, you don't want to go hunt through stuff, call 211. 211 is set up statewide. Lots of questions can be answered there. You don't have to call your local government for some of these. Just call 211.
Wonderful. Susan Trachsel, thanks for being on the program today. And thank you for listening to us and tuning in. I noticed before we got in, there were wonderful programs already rolling, like Buy Local Lincoln County, talking about COVID, coronavirus. So stay tuned to local media, I think especially the county's website. And even Samaritan and the county or the school district, they have landing pages. I think it's very easy to see where the latest information is. So we will get together in another meeting after our radio and talk to other organizations in the county. Stay safe out there, everyone, and we'll be back with you soon with more information. Thanks for listening.